invite you. Come on there. I'm gonna see the thing, and then you're gonna make me out of the host. Wait, notification. Here we go. Okay, and we are live. I want to thank everyone for tuning in to a very special edition of Off the Record on the People's Podcast. I'm very honored and excited about what we're going into tonight. This is an amazing subject. I want to thank Ariane for coming up with the idea. I want to thank all of the panelists for stepping up and ready to address this, but I'm going to turn this amazing platform over to Bianca. It's on you all, ladies, women, sisters, all of that positive stuff, energy, magic. It's on y'all. You can do it. It is through the women. All that good stuff. All right. So Bianca, I'm out of here. So it's on y'all.
Thanks, Chaz. And thank you. Before you pop off so quickly, thank you for allowing us to use this space, your platform, and allowing me to facilitate this conversation. I'm excited. So thank you. I know you're hopping off and eager, but thank you.
Listen, I let the women do what the women do, okay? All right, Bianca, kick me off.
Okay, just making sure. All right. Good evening, ladies. How are you feeling tonight?
Good. How are you?
Good. Welcome. I am really excited and honored to be able to just kind of have these conversations. There's nothing I love more than talking about motherhood and babies and Black women and our magic and our health. So thank you again, Ariane, for coming up with this awesome and really important conversation and topic. So as I said, I am Bianca Alexis, or maybe he didn't say, because I don't even know if he introduced me. He was so excited to get off. So I am Bianca Alexis. I am a mom of two really amazing kids, and just going to be facilitating this conversation tonight. So I would first like to start with some introductions of our awesome panelists, starting with Ariane Mohammed, who has a bachelor's of science in nursing and has been practicing nursing for 7 years. She is currently working on her master's and is a mother of 3. And that alone, going to school and mothering and working, hats off to you. That's, yes, all of the things in the middle of a pandemic. You get all of the props. So welcome. Next is Dr. Mendesha Smith. Dr. Smith is graduated from East Carolina University in Nurse Midwifery program in 2015 and the Doctorate of Nursing Practice program in 2017. She is a hospitalist certified nurse midwife working at Southeastern Regional Medical Center in Lombard, North Carolina. During her career, she has provided a full scope of midwifery care within birth centers and practice within a community hospital. Dr. Smith has been an active member of ACNM for 5 years and has been a member of the ACNM Program Committee for 4 years and is the present ACNM Program Committee co-chair. And before I go any further, what does ACNM stand for?
It stands for the American College of Nurse Midwives. It's a professional organization.
Awesome, thank you. I work full-time in HIV, so I'm in a land of acronyms, so I always want to make sure that I am clarifying. So thank you for that information. Last but not least is Swiya Mohammed, who is a certified nurse midwife that proudly serves rural and underserved populations in North Carolina, providing prenatal care and gynecological services. She earned her bachelor's degree in nursing from Winston-Salem State University and her master's degree in nursing and midwifery from Frontier Nursing University. Her background is in women's health, consists of a freestanding birth center, rural public health, and community hospitals. During the COVID-19 pandemic, Swiya began offering virtual childbirth education courses to families so they can continue to have access to comprehensive education that is needed to prepare them for the birth process. Swiya is affiliated with the Black Coalition for Safe Motherhood, which provides community workshops aimed at providing families with tools to help them communicate effectively and advocate for themselves for safer birth outcomes. And that alone is a word. So thank you for the work that you do. So let's get started. Ariane, this is your amazing idea. So thank you for bringing it to Josh and bringing it to fruition. So tell us a little bit about yourself and your birth story and what makes you passionate about Black maternal health.
Okay, so this idea was kind of sparked because I'm a part of a group on Facebook called Black Nurses Rock, which most nurses who are Black are part of that group. And one of the threads on there was different nurses just speaking about their birth experience and the complications they encountered. And, you know, as nurses or really anybody who's educated, you go through school and they tell you all these statistics. And, you know, you're thinking, okay, well, I'm educated, or, you know, I have such and such background, so that's really sad, but that's not going to happen to me. Well, in Black maternal health, that's just not the case. It doesn't matter your education, it doesn't matter your background. You know, we are all at the same exact risk for certain complications than our white counterparts. So although we would like to think that because, well, I'm a doctor, or I'm a lawyer, or I'm a nurse, or I come from this such and such family, it really doesn't matter when you're in labor and you're in that room and you're pretty much at the will of whoever, you know, the doctors and whoever's taking care of you. So one thing that makes me personally passionate is my own birth story, because it kind of just put into fruition, you know, what I'm saying, you know, like, okay, I'm thinking, well, I'm a nurse, so I'm not gonna let these people do me any kind of way. Okay, we're not having it. You know, my mother's a nurse, so I'm like, you know, she's gonna be there, I'm gonna be there, it's gonna be all good. Okay, that's not what happened. So I only have 2 birth stories because although I have 3 children, I have a set of twins. So I've only actually been pregnant twice. But my first birth story, you know, when you're in school, they teach you all of these warning signs when you're in labor, like look out for this, look out for that. Granted, I'm not a labor and delivery nurse, but I remember these things. So I'm in labor and I'm like, hey, you guys, you know, my water broke, there's meconium in the water, the baby's sitting really high, and I think something's wrong. They're like, nope, you're fine. You know, I'm like, well, my blood pressure is just steady rising. It's getting really high. Like my blood pressure, I think it was like 180s over 1 something. And they basically told me, well, this is your first baby, so you're a little stressed out, you know. And I'm thinking, well, yeah, I guess I would be a little stressed out, but I don't think it's supposed to be like stroke level, you know, this is a little high, you know. But they kept brushing everything off. So I ended up having to have an emergency C-section. My son ended up in the NICU because he actually, they drew his blood and he came back with an infection, go figure, and a fever. So he ended up going to NICU, and actually while he was in the NICU, he became dehydrated, and the nurse, I didn't tell them I was a nurse, but the nurse that was taking care of him, when I explained to her that, you know, he was dehydrated, she told me herself that she was going to chart, which means she was going to put in his medical record that he had a wet diaper, even though he had not. So of course I told her, okay, we're not going to do that. We're going to call the doctor. You know, he was on IV antibiotics, which was probably dehydrating him, you know, and it's just amazing how she thought it was just okay to chart something that did not happen. They drew his labs. He was dehydrated. He ended up having to be put on fluids. But, you know, dehydration can definitely, just like in the elderly, it can really hurt a baby. So I was like, if I was not sitting here with him, like, you have just put this in his chart and went on about your day, and then now later when I come to check on him, you're explaining to me why something's wrong with him or trying to cover up whatever you did or didn't do, you know, it's, you know, it's like all these bad news stories you hear was happening, you know. I'm like, what is going on? I know she did not, so I had to fire her. She had to get out of my room. But that was my first birth story. So that was a little traumatic for me. And my second birth story with the twins, because of my first one, I was a little more diligent with paying attention to everything. You know, they wanted to deliver them at 25 weeks, but they couldn't give me a reason why they wanted to deliver them. I was delivering at a teaching hospital. So, God, they just be doing all types of crazy stuff. But they wanted to deliver them at 25 weeks because they shared a placenta. But one baby was smaller than the other. But they were both doing fine, if that makes sense. You know, in nursing, you're taught that everybody is within normal limits for themselves. So just because baby A, you know, was a little bit smaller than baby B, but they were both doing the same exact things, but they wanted to deliver them at 25 weeks. That didn't happen. They were delivered at 37, I believe. And right before I went in, they told me my platelet count was low. So I said, okay, well, should we have something on standby? Should we do something about that? Oh no, we've delivered people with platelet counts much lower than yours. You're going to be fine. Okay. Well, I ended up hemorrhaging. My mom was there. And you know, like I was saying, like as women in general, you know your body, you know how you're feeling, you know, so don't let people try to tell you how you're feeling just because you've never experienced something before. You know, I was feeling really, really bad. And I'm like, dang, you know, my mom was standing and she was like, well, she's bleeding a lot. She's bleeding a lot. Are you going to call the doctor? And the nurse was like, I think she's fine. So about the third time my mother said it, third time she said it, another nurse came and they decided that I was hemorrhaging. My hemoglobin was a 6 by the time it was all said and done, which if it's supposed to be at least a 12. It was a 6. I was literally bleeding to death. And they had to take me back into surgery to stop the bleeding. But once again, like I said, if my mother was not there advocating for me, not letting them just keep telling her, oh, it's fine, I easily could not be here right now telling my story. The twins were, you know, they were small, but they were big for twins. They were 4'1" and 5'5". And they wanted to take them to NICU. They wanted to do all these different things, but there was nothing wrong with them. But they kept saying, oh, they need to go. And for what? Their vitals were fine, oxygen level fine. They were eating fine. Everything was fine, but they continuously want to take my babies to the NICU, which when you're breastfeeding, it's best to keep your babies in the room, you know, like with you, you know. So I'm like, why do you know, they kept pushing the formula. That's another thing I had to go through when with both my births. Actually, oh, you're tired, just give them this bottle. You know, they wanted to push the formula, so I had to go through that as well. My youngest daughter was a little bit small. They did the car seat test and they said she was fine. Okay, so then on our way home, I was sitting in the back seat with them and she began to turn blue because she was not fine. She could not sit in her car seat properly, even though they stated that she passed her car seat test. So I could have also got home to a dead baby. Listen, it's just all types of trauma. So like I said, so my personal birth stories, that's what makes me passionate about Black maternal health, because with all of my education, with all of my mother's education, you know, the only thing that really kept me here was us really just pushing and advocating. And the only thing that pretty much kept all three of my children healthy was us advocating, because you're kind of like I said, at the will of these other people who are supposed to be helping take care of you, you know. And it's already been proven that people in the medical field think Black women just complain more. So even though you may have a concern, it gets pushed to the side, regardless of what it is. You know, it gets pushed to the side, whether it's about you or your child. So we have to learn how to advocate for ourselves, or, you know, have somebody there to advocate for you. Because if you don't, you know, like I said, I could easily not even be sitting here talking.
Mm-hmm. And that's real. And I think especially right now that advocating for self or having somebody advocate for you is so important, but also during a time of COVID where there are less people who are able to be, you know, at appointments with you or in the delivery room with you, I'm sure it even brings on even more challenges. Suya, tell us a little bit about what brought you to your work, and how do you think specifically it impacts or benefits Black women?
Well, what brought me to my work is really just because I'm a Black woman, and I have a mother who was a Black woman who I witnessed just growing up not being heard and listened to. I've always just felt like I was called to midwifery, but what keeps me going, just like what Arian said, is really just the stories that I hear every day from patients, the stories of being mismanaged, the stories of being aggressed upon, the stories of hostility that they've experienced Just recently, I had a patient, a client, who wanted me to be there for her delivery. And even though I was not technically supposed to be, I told her I would come to the hospital on my day off to catch her baby. And from that experience, you know, she told me, like, I could not imagine how I would have been treated if you were not here. I mean, the hospital staff, because I came in plain clothes and I delivered at a different hospital from where she was. So they had no idea who I was and that I had taken care of her throughout her entire pregnancy. So they didn't know who I was. So I came in there, you know, clothes, dressed down for this very reason, to scope out the hospital, to scope out how they would treat her during this experience. And when I tell you, they were nasty. It was blatant racism, like she was a nuisance to them. Just as simple as when I asked them for a birthing ball for her to be able to sit on, and it was like, for what? It's like they said, and I asked them for underwear for her and pads for her to get up and get on a birthing ball, move around. And they asked, well, what is she to get up for? Did she use the bathroom? And I said, no. What reason does she have to stay in the bed? And it was like, oh, okay, you know, didn't want to get it. And so eventually it was like, so who are you? Are you like her friend or something? And I'm like, does it really matter? I'm her midwife. I've been taking care of her entire pregnancy. So they were, of course, once they realized that she had someone there advocating for her, they completely changed their attitude and demeanor. And it was, oh, it's whatever you want. You know, the physician who was at the nurse's station said, you know, he just looked at me and said nothing because he already knew what it was, and that she had specifically asked me to be there for her because she did not want him to catch her baby. So it was a lot of animosity, but literally what keeps me going is knowing that so many of us are dying, so many of us have so many negative stories, and it's important for us to show up for our women, because it doesn't matter the education somebody has, you know, how well prepared they think they are. It is very, very important for us as Black women to have providers that look like them, to advocate for them, because the level of relief that comes across my patients, especially because I am the only Black person that practices in the county that I work at. And when they come to the health department, Black face, they immediately are comfortable. I can see the difference. They let their guard down because so many of them do not open up to their providers. They don't feel safe. So it's important for me to continue to show up, to be there, to be a voice, to advocate for our women, because we need it.
Absolutely. Literally everything you just said. Yes and yes. Dr. Smith, tell us a little bit about your work, and if there's anything in particular that Black mothers, Black women should know about how to advocate for themselves in their birthing process.
So I definitely think if you're a Black woman, you need to educate yourself, and you have to have someone to advocate for you, whether it's, you know, you have found a Black provider that you trust, or whether you have a doula that is Black. Like, when I'm listening to Ariana, her story, I mean, every statistic is being mentioned, from neglect of the mother to neglect of the baby. They assume that Black babies, you know, we are stronger babies. Don't get it twisted. We are stronger. But the same token, that doesn't mean that we don't deserve the care that we need to get. And so that's why, you know, you get neglected. And yes, a lot of the things that need to be done, they can be done in the room right in front of you. Don't instill all this trust in people and like not ask questions and stuff. Like, you have to be aware and have someone for you. In regards to my work, I basically like triage anyone that comes in. I do vaginal births. I assist in C-sections. One thing that's great about having a midwife, if you choose a midwife, is that we are very personable and we will follow you. Like, you end up in, you know, say things aren't going right, you know, I'm very transparent with my patients. They know as much as I do. If something's not going well, we need to go to that OR, I'm gonna follow you there. I'm not gonna leave you hanging. You know what I mean? And I'm gonna see you when you come out as well. And then we're more likely to help you with breastfeeding. That's another thing that Ariana said. Black women are more likely to be pushed formula than white women are being pushed. They want us to drink that poison, and we don't want to give it to our babies. So, you know, I just think the biggest thing is advocacy, and then also midwifery as a profession. It is a Black profession. It is whitewashed now, but it is a Black profession. and we have an obligation, Swe and I and other Black women or Black men who are interested in midwifery, to join the force and get representation for our women.
Absolutely. I feel like here, so I live in the DMV area, and I know a lot of doulas and midwives, and I feel like there is this, I don't want to say a movement because I think it's always been, but at the same time, I know more women who are utilizing doulas and midwives and birthing centers, and really just Black women, and really just kind of taking back our birthing process and what that looks like. My son was born at 27 weeks and spent 8 weeks in the NICU, and so I didn't have the opportunity, I think, to I don't know, advocate for myself. My birthing story is a whole show, but I think there are definitely things that I would have done differently. And I think when I had my daughter, I made it to 37 weeks, but even then, there are things that I wish I would have done differently. And one of those things is I wish I would have utilized the services of a doula or a midwife, because I think there's power in that I just wonder how things could have been different for me and my kids, but neither here nor there. Sweya, how does one find a midwife, or what should a mother look for in terms of choosing a midwife or a doula or a community birth worker?
So the first thing I will have to point out is the difference between a doula and a midwife,
Mm-hmm.
because a lot of people for a more holistic approach, the word doula, I think it comes around more, and doula is a support. They are somebody who provides physical, emotional support, education for you throughout your pregnancy, for labor, and the postpartum period. And a midwife is an actual provider who provides your prenatal care, assists during delivery, catches your baby, repair your bottom, prescribe any medications. They are your provider, right? So it certainly is important to have both, because they serve different purposes for you. And so a midwife can practice in a home birth setting. If you're interested in a home delivery, a midwife can practice in a freestanding birth center. I know there are several around the D area. And they can also practice in a hospital. Dr. Smith is a hospital midwife, like a hospitalist in that works for a hospital practice. So the first thing would be to really, it depends on your insurance first and foremost, or your financial situation, to determine where you're able to deliver, what you're able to afford, because of some private practices that have midwives on staff, a lot of the times, I know in North Carolina, the ones that do have midwife staff only accept private insurance. And then there are hospital practices that may be affiliated with the local health department that have midwives, but that means you have to deliver in a hospital. So it really depends on your insurance, and then also where you like to have your baby. Where you live in the state of North Carolina, their home birth midwives have to have a certain type of licensure, like a nurse background. So not every state or city may actually have a home birth midwife that does in-home delivery. So to be able to find, for instance, like if you're interested in looking for freestanding birth centers, there's a website, birth centers with an S, birthcenters.org, has a list of birth centers across the United States that are accredited through this organization. I think they may even list those that are not accredited. But if you're interested in see where actual freestanding birth centers, that is one website. Outside of that, the best thing to do is to research the local OBGYN practices that are in your city, and look through their list of providers, and they will tell you if they have midwives on staff, if they only work in a hospital, if they only work in the office, or if they also attend deliveries, if that's affiliated with their hospital.
Thank you for that. Dr. Smith, is there anything you'd want to add in terms of what an expectant mother should look for in terms of a midwife? Or are there any instances where a midwife might not be the right choice?
So I would say two things. So one thing about the practices, everyone should have the statistics. The hospitals have statistics. I would look them up. You know, what is that C-section rate? If it's 30%, you know, you need to start asking some questions because that's high. So I would look from that avenue. I always believe every patient needs a midwife, no matter if you have, no matter your type of birth or what kind of GYN. You know, we take care of women for the lifespan. So from menses all the way through to menopause. You know, we offer preconception counseling, do prenatal care. So, and then a lot of midwives, you can add on skills. Like some midwives might add on colposcopy. I've added on endometrial biopsy. Like it just depends. But sometimes just from that personal relationship and being heard, every woman needs a midwife from that point. Or, you know, say having issues with breastfeeding. Yes, there are IBCLCs, but a lot of time I'm the IBCLC, even though I don't have the the qualification for it. But as a midwife, I'm taught how to help women breastfeed. So I don't really think there's a limit. And sometimes, you know, you might go to the doctor and just not feel heard and be like, hey, can I have a visit with the midwife and talk about X, Y, and Z? So, and a lot of times as well, midwives do co-manage as well. So yes, the doctor's involved in your care, but you do see the midwife sometimes. Or even if you're on the unit, like, you know, say I have someone that's um 30 weeks and she's in labor and she's 10 centimeters and the baby's coming out. I'll just still do the birth, but the physician will still be involved in the care. You know what I mean? Like managing, because it's a high risk. But I'm still involved. I'm still, you know, how's your pain? You know, is there anything I can do? You got questions? Still involved. So that's what I would say.
Thank you for that. Ariane, I know you had mentioned when you were telling your birth story, and even in our pre-conversation, you had mentioned that, you know, originally you didn't tell the staff that you were a nurse. Do you think that would have made any difference or you didn't tell them you were a nurse at first, do you think that would have made any difference in your care or treatment?
For my personal experience, when they know that you know, it does make a difference. It should not, but as soon as you tell them, okay, like with my son, when I told her, you know, well, he's dehydrated and she tried to pull that little stunt, I said, okay, well, I'm just gonna go ahead and turn off his IV pump. She was like, excuse me. I said, yes, I'm a nurse. I know how to work that pump just like you. I'm gonna turn it off and we're gonna do X, Y, Z. Like his care from that moving forward was like 10 times better, which is crazy. It doesn't necessarily mean, like I said, that during your birth or even with postnatal or prenatal, that it's going to save you from anything either. But do I think it makes a difference when they feel like you know something? Yes, because they take advantage when they feel people are ignorant. You know, they can just say whatever and do whatever, and people will trust them. It's like, you know, because you're supposed to know, you're supposed to be here to take care of me. And even if you second guess yourself, like, you know, like she said when she was asking, how's your pain? I've personally seen that in all types of areas where Black women's pain is just completely ignored, you know, and oh, she's just being dramatic, and oh, she's just complaining. Like, you know that you're in pain, you know. So I do think it makes a difference. But like I said, I also don't necessarily feel it'll overall save you from anything either, if that makes sense.
Do you have any, with your experience or even as what you've seen as a nurse, I know you said you're not a labor and delivery nurse, but in the medical profession, do you have any tips or advice for women on how to, one, advocate for their health, advocate for their well-being, and even just navigate the systems? Because at the end of the day, this is part of a bigger system that is not set up for us, if you will. So do you have any thoughts or advice for women, especially new moms?
Well, one thing, like the doctor stated, is research things for yourself. There's nothing wrong with that. Researching for yourself, you can research your own birth plan. There's nothing wrong with sitting on a birthing ball. You know, like Suya said, a lot of women, especially if it's their first birth, think they're just supposed to sit in the bed, you know, which is not really conducive to labor. So you can research things for yourself. You can take care of yourself. They have all types of things at CVS now. You can buy your own blood pressure machine. You can, you know, track your own diet, make sure you're watching what you eat as far as processed food, things that are high in sugar. Just sitting here and taking your prenatal vitamin every day is not gonna make you be healthy. So there are things that, even if you're not a nurse or a doctor or the most health educated person in the world, that you can do for yourself to help yourself out a little bit. And always advocate for yourself. Pay attention to your own body. One of the things that I saw a lot in that thread was a lot of the Black women, they actually had strokes during labor, and they were complaining of signs of a stroke, and they were ignored. So if like, okay, I'm not feeling well, I'm feeling dizzy, I have a headache, this and that, don't let them just brush this off to, oh, well, this was what happens during birth, or this is what happens when you're pregnant. Like, pay attention to yourself. I know my body, Suya knows her body, your body. I cannot tell you how you're feeling. The pain thing is a very, very big thing. It's very big. Our pain is ignored all the time, whether it's during labor or in other areas of the hospital. It's ignored a lot. Yes, labor is, of course, we all know that it's painful. Anybody who's had a baby knows that it's uncomfortable. It can be painful, but there are things that that your provider can do to help you out, with that pain. And as far as advice for first-time moms, I would say, number one, when they say it takes a village, that is the truth. Okay. If you have, your friends, your mom, whoever, when my baby was in the NICU, I had sisters from the mosque, as well as just coworkers who were fellow nurses who made me food, stopped by and gave us snacks, just to alleviate things. My mother-in-law came by. It's little things like did our, laundry, and my son is actually only 14 months older than the twins. So I basically had 3 babies. So I had 3 car seats, a triple stroller, 3 cribs. Girl, I had 3 of everything up in here, 3 walkers. Okay. It looked like something what's that Christmas song, in a partridge in a pear tree? Something like that. That's what it was like in this house. Okay. And looking back, I also had postpartum depression, which I don't know why as a nurse I didn't pick up on it, but I was very, very emotional, very sad, kind of sometimes despondent towards the children. But with so many people around me helping me, it helped me out a lot. And also still take care of yourself after you have your birth. You have to stay hydrated. You have to stay hydrated. You have to stay hydrated. You can still use that little blood pressure machine just to check your blood pressure, because sometimes your body still has to reacclimate to you, the fact you just had a baby. My blood pressure didn't come down for at least a month after I had the girls. So definitely have a village around you. Definitely don't feel guilty about going to take that nap. Don't feel guilty about taking that quick run to the store by yourself. Your baby will be okay, honey. He or she will be there when you get back. Okay. You have to take care of yourself if you're going to take care of, of your child. When you first have your first baby, the first thing people ask you is, oh, when are you going to have another one? Telling people to mind their business when they have it. How about that? Okay.
Come out of my uterus.
Yes, they ask all that all the time. So first time moms, don't feed into that. Okay, just worry about the baby or babies. If your mother multiples, just worry about that. Don't worry. Don't worry about that other stuff. Okay, and don't let anybody push anything on you that you feel uncomfortable with. You're that child's mother. You know what's best for them. Yes, there's other people in your life who have raised babies. You have grandmothers, you have aunts, whoever, and everybody is going to give you advice. And there's nothing wrong with internalizing that and taking what you want and then ignoring what you don't want. You're that child's mother. And like I tell everybody, nobody's going to advocate for your child like you. Nobody. Don't let these people tell your child got ADD, ADHD, autism, and all these other extra things. Mothering never stops. Okay. So just be prepared for all these first time moms out there. But my biggest thing is definitely it's okay to have help, and definitely have a village around you, and pay attention to yourself after you've had your baby, because your body still has to acclimate.
Absolutely. And I think you said it with the village. Like it's amazing what the power of community. Before my son was born, I was on bed rest for 6 weeks before he came, and then he was in the NICU for 8 weeks. But my fridge stayed full, and people came and dropped out food and checked in, and that makes a huge difference. And I think even later, you brought up the postpartum depression. That's very real. I felt it with both of my children, and I don't think that's something that we talk about enough. Dr. Smith, Asria, how do you help women navigate postpartum depression, or what are some things that you look for, have them look for as they kind of, I think nowadays it's a lot more than just the baby blues. It's tough, and I don't know if we're talking about it enough. Either of one of you want to.
So I always screen people before they leave the hospital, and I stress to them and whoever their family member or whoever is with them that, if you notice that she's not acting her normal, then you need to get her help. I said that is real. Tell them, I was like, people drive their kids into the sea and try and drown themselves. I'm like, that is no joke. And then also, what I did like at the birth center is we brought people back at 2 weeks and we reassessed them then. And then we also brought them back at 6 weeks. And another thing is, as midwives, we were just so open that people would just come talk to us. Like, I had one, she messaged me on Facebook and she said, my husband said I need to message you because this is the way I feel. And I said, okay, I'll meet you at the birth center. It was at night, so I told her I'll meet you there tomorrow. And we sat down and had a conversation and talked. And I was like, yeah, you're postpartum depression. So like and then we started the process. Let's start with counseling first. Because it depends. Like some people want medication straight away, but that's not always the answer. You know what I mean? So start with the counseling, see if we need medication. Is it because we're not getting enough sleep? Like just trying to figure out, like, where's this coming from and what we're gonna do about it. But it's so serious. Like I will not discharge someone without having it, and the nurses think it's a joke. Like I had one say, "Well, everyone's depressed in Robertson County," and I was like, that doesn't make it an excuse not to follow standard of care, which is tests for depression. And I've had people come back, they score a 13, 16 on the depression screen. It's like, whoa, whoa, whoa. You know what I mean? It's awful. And then you order a side consult and just take it from there. But yeah, like just if I was, expecting and I just had a baby, like I wouldn't leave without having some screening, making sure I've got adequate follow-up.
So yeah, anything you want to add to that?
Yes. I would definitely add that screening like towards immediately after having a baby, evaluating, but then a big part of that is education. So in the childbirth education class that I teach, a lot of education that I used to do at the birth center is helping women to understand like what to expect and know that mood changes are going to happen, but having your support team, having adequate sleep is going to be very important. There are some people who have postpartum psychosis, and those are the people you hear about who drove their baby off a cliff or set them on fire because they thought there were demons. That legitimately does happen because of hormonal changes. But because it is so common, educating people ahead of time so that they know what to expect, and like Dr. Smith said, helping their partners know what to expect, or the signs to look for is a big part of it. And sleep is a huge part of it. I can't tell you, because we both worked at the birth center together, so I can't tell you how many times I would go do home visits and check on our patients in their home 2 days after they had their baby. And then, like she said, they would come back in at 2-week mark and then at 6-week mark. And a lot of times it was stem from sleep deprivation, especially when it's your first baby and you're used to sleeping as long as you feel like sleeping, whenever you feel like sleeping. And then you have to deal with the changes that your body is going through with just having a baby, plus a baby that's crying, plus nipples that are constantly burning, bleeding, and you're hungry and you're cramping and you're going through so many, and you're sweating all the weight off that you gain in pregnancy. So with so many different things going on, and then on top of that, you're not sleeping. And so something that I learned that sometimes if you can just get 6 hours sleep straight, kind of what help reset your brain for you to be able to recover to go another day. Because if you're waking up every hour, every 2 hours, day after day, a lot of times those mood problems will set in. So sleep is in it. Nutrition is a big factor, so that's why it's very important to have your support team, people to be like people want to come hold the baby. No, come clean my house. I need you to come to feed me, not to hold my baby and look at me. That's not what's important. You can drop some food off at the door, like take selfies with my baby. What you need is somebody that's actually going to give the support that you need so that you'll be okay. So having that village, we see that a lot of times because I mean a lot of our Black women are in silence because first of all, half the time, just being realistic, half the time we're having babies with people that don't care anything about us, that we're not even in a relationship with, and we're still needed to work full time. And just seeing the difference in how our birth center clients, who are oftentimes highly educated, plan their baby in advance, have all the support in the world, they will oftentimes suffer with depression because they had support. Their husbands fed the baby at 1 a.m. so they can sleep 6 hours straight, and then they got up at the 3 or 4 o'clock in the morning feeding. Well, we don't have that, so we suffer in silence, and we don't have support. The baby father don't want to be around, don't believe the child is his, and then you have a couple other children, so we're constantly suffering in silence. And this is why a lot of times this depression lingers for such a long time, and it comes out, like Ariane said, with the way that we mistreat our children in anger because we have so much frustration, disappointment, so many other things going on, coupled with the depression of just the normal changes of having a baby.
Absolutely.
Just piggyback off of what she said when she mentioned the free classes. That is another thing I think first-time moms, don't be ashamed to do that. There's all types of classes offered, breastfeeding classes, CPR classes, like she said, maybe signs and symptoms of postpartum, and also what she said about the father helping, even sometimes, even if he's there, it's like they think we just knew how to be a mom. I'm not kidding. It's like they just think because you're a woman. And sometimes I really had to tell my husband, like she said about that one little feeding in the middle of the night, how that can make such a big difference. Granted, I may have told him in a screaming manner because I was just literally exhausted, but I told him, like, you have to help me. I cannot do this. Sometimes you have to tell them because they don't know. They think that you just got it. And it's like, no, I'm drowning. I am drowning. And like I said, I picked up on my own depression, but some women, you don't pick up on it. You have all these behavioral changes, and that's really what it is the postpartum depression / anxiety / exhaustion that you're going through. So for other people to also know the signs, and also, like she said, just being real, a lot of times also when you have your baby, the people that you would want to help you have their own babies. They have, 2 and 3 and 4 of their own babies. So, they come over to help, and it just turns into a house full of babies. So, not saying that they can't help in a different way, but, pick your help wisely. And like she said, don't be afraid to tell them exactly what you need, because like I said, they'll come over, sit on the couch, and girl, you look so good. That snapback is real. Can I hold the baby? It's like, do you mind putting those dishes in the dishwasher? Or do you mind, and I had a friend who did this when she was pregnant, which I never thought of. I don't know why. She actually made freezer meals for herself before the baby, and she stored them in her deep freezer. That way, after she had the baby, even if somebody couldn't make it over to cook, she could just pop it in the oven. And you can find those little things on Pinterest, on YouTube, easy little freezer meals that aren't, like high in sodium processed food. You don't have to go get Miss Stouffer stuff. You can make your own and pop it in the oven. And that's very helpful too. Planning.
All of that. I've heard planning, the importance of sleep, all of the sweating that happens after, which Swea, before you just said it, nobody told me I was going to sweat the way I did. It was horrible.
All that weight comes off in 2 weeks in the form of sweat. Sweat,
breast milk. It was, anyway, neither here nor there. It was a lot. My body was doing things that I was like, and then again, my my second pregnancy was full term. I didn't know what a full term pregnancy looked like or was supposed to feel like, or and I remember when my son was born, all of the things I learned while he was in the NICU, the classes I had to take, the, learning about his heart rate, the monitors, all those things. And I remember saying, like, wait, people just have babies and leave with them in 48 hours? Like, I couldn't understand it because I was like, people just take babies home. There's so much to learn. But the second time around, me and my daughter, we left and I was still confused and sweaty. But I know we talked, a lot about the importance of a village. That is huge. How do we adjust or accommodate or change that with COVID? What does a COVID pregnancy or having a child in the midst of a pandemic look like? What do we need to think about? And I say we, meaning other women, because this one is done with us. We're to and through. But for other women, like, what does that look like? Things that they should consider, or yeah.
So I would say right now there's a battle because we know COVID hospitals are restricting visitors. Initially, there were now hospitals really across the country were not allowing you to have anybody during your birth, like, at all. Obviously, that is not okay. People need someone to advocate for them. Then there were changes. Certain hospitals were allowing you to have one person. Most recently, there's been a lot of push from grassroots organizations and midwives and doulas that are pushing to make doulas essential part of pretty much essential so that they can be present for birth. So there are a decent amount of hospitals now across the country that are allowing doulas to be a support person outside of your partner, because every time your partner or your mom is the best support person for you in labor. But because of COVID, there's a lot of restrictions with that. Sometimes, if the mom is COVID positive, they can't have anybody at all. If they have a person, they're not allowed to ever leave the entire 2-3 days they're there. So it's difficult for someone to actually have the support that they need. A lot of doulas are doing like virtual doula, like, so they're FaceTiming live the whole time they're in labor and doing virtual support. Part of the reason I started doing the virtual childbirth education courses is because most times childbirth education class, which a lot of people don't necessarily take advantage of, but certainly should, to prepare yourself for labor, birth, breastfeeding, postpartum. But because of COVID, a lot of those things went away. So the little bit of support that people were having were no longer available. In-person classes were no longer available. So I started doing the virtual classes so that women can educate themselves, learn as much as they can, so that their partner can learn as much as they can to be the support person for them, because they a lot of times can't bring another person into the hospital setting with them. So a lot of things are turning virtual, and just being really creative, because there are still many, like the hospital where I practice at, they're still not allowing doulas. I believe there are some others, there are close by hospitals to where I work that are allowing doulas that, they're saying that they're essential and they should be allowed to be in, but it's a lot of hoops they have to jump through. Like, they have to be certified through the hospital, or they have to be part of the hospital staff, as opposed to you bringing in your own person that you paid out of your pocket to have. So it's a whole lot of legal drama that's going on. Midwifery is drama always, because like Dr. Smith said, it's a constant battle of Black women taking back the profession that was first stolen by white males and then by white women. So us taking back our original profession. And then now this is adding another layer to it because of this pandemic, on top of the fact that this pandemic has highlighted the fact that racism is a public health emergency, and that Black women die at 3 to 4 rates from white women from childbirth related causes. So just being able to be creative and find the virtual support that you need, or birth in a hospital that allowing you to bring in your own person. Just like Dr. Smith said, like, research the hospital ahead of time. You don't want to go to a hospital, deliver somewhere, and they won't even allow you to bring your doula. And, if that's something that's important for you, you should not go to the hospital or choose that place to birth at.
Thanks.
Yeah, I agree with Swea. For example, where I work, I had a patient follow me to my practice, and she said she wanted to have a doula, which I was completely fine with, because I'm like, yeah, man, doula, yeah. And I went to my program director, and he said, his initial email, I was shocked. He didn't agree that it would be okay to have a doula, and I was blown. And so what I did was I fought for months to allow doulas, and now we can have doulas. So definitely, do your research and look that up to see what your hospital accepts. Because you can't forget, you're the consumer. You have rights. You should have informed consent. You should be able to make
Mm-hmm.
your decisions. You should always have options. Don't let them tell you there's only one option, because there isn't. Usually more than one. And I have patients surprised when I say, well, you have options, and look at me like, you know, you've got
Exactly.
options. So
Yes.
don't forget that, you're hiring them, not the reverse.
Mm-hmm.
And then I would say, in regards to when you go home, you need the support, but limit who you let in and out. Like, you might have the same person frequently, and making sure they're wearing a mask, washing
Mm-hmm.
their hands. You might go as extreme as in checking their temperature, but just be wary. And, like, if it's someone that you notice they're always posting, going out here, there, and everywhere, that might not necessarily be someone that you need to come help. They probably need to drop the food off at the door and leave. Um, versus,
Mm-hmm.
someone that's staying at home and following the rules. Like, I would, just be careful with who you pick to come to your house and be around your baby and you, because that would increase your risk of catching the COVID. So, um, yeah, that's what I would say. Do you have anything else, Weir, in regards to postpartum?
No, I don't think so.
I think those are all really, um, really excellent points, because I think so much, just what you were saying, Dr. Smith, like, I think sometimes we forget that medical professionals work for us. Like, we can fire them, we can find someone new, we can, um, you know, date them, if you will, get to know them, get to, ask for referrals. I think many times we may not feel empowered to do so, or intimidated by medical professionals, where it's like we just maybe just taking things for face value. Or for some folks who might live in more rural areas that might not have as many options in terms of the providers that they can choose from. So just that limited access to care can make things more difficult. And I think that's why it's really great for there to be, the network and option of having a midwife or having doulas, or being able to really have some of more of that community support, and what that looks like, and just how that can also just change the whole trajectory of how we engage in healthcare. We have about 5 minutes, so one, I just want to check. I'm making sure I'm also looking in the Facebook chat situation on this side. But before we wrap up, a question for each of you: what do you want Black mothers to know about their maternal health, or to do, or to feel about their maternal health, or about their health period, whether of childbearing age, whether wanting to bear children or not? What should Black women know?
I guess I'll go first. I want Black women to feel empowered, and I want them to feel in control of themselves when they're having their babies. And I want them to be happy. I want to hear more positive birth stories, with positive outcomes, healthy baby, healthy mom. That's what I want to see. We live in a very, very, good country, so to speak. So, as there's no reason, other than, like she said, blatant racism, that we can't have these same, birth, outcomes that these other moms have. Not saying that there aren't health disparities in the Black community that play a part, because there are. But I just want Black women to definitely feel empowered, and to have happy birth stories, and to know that you can be more in control of your own story, and more in control of what what goes on. You just have to educate yourself. There's nothing wrong with educating yourself. And you just have to advocate for yourself.
Dr. Smith, what do you want Black women to know, do, or feel about their health?
I want them to know that you are worthy, you deserve the best, and we need to start standing up for what is right. And if you're receiving care that's incorrect, we need to complain about it. We need to, don't be silent. Like, I'm the first one to start running my mouth when I think something's wrong. But
Yes.
you be empowered, be informed, don't put up with. Know you have options. Yes, some people, like you said, in rural health don't have as many, but that is also where demanding professions, midwifery, we have a job to do. We need more midwives. We need more midwives of color, and we need these states to recognize that they are limiting access to care by having supervisory language on midwives, because that's how North Carolina is. We can't just go up and practice somewhere wherever we feel like it. And that is limiting how we can care for our people. So if it's not you directly, in your individual care that you can make change, I think you can also make change from the law standpoint. Like, how is the law affecting the care that you can receive? So go out there and do your thing. Do not hold back. You deserve the best. No questions asked. That's what I would say.
Love it. Sweet.
I absolutely agree with everything Ariane and Dr. Smith said. I would add that there are providers, there are midwives, there are Black doctors who are here and fight this fight every day for us. And so seek us out, because there are many of us who are around and who care and who provide, who do this work every day because we're passionate about it and we want to make a difference in the lives of our people. Just like everyone else said, you are the consumer. I don't care if you have Medicaid or Blue Cross, insurance is paying for your birth. So you have the right to say yes or no. You have the right to know all your options. You are the consumer. You have the right to refuse anything. And another thing is you not to just trust anybody because they have doctor in front of their name. Most of the time, if you're going to a hospital, it's a resident that's going to be there doing your delivery, not the supervising attending physician. So don't just trust somebody for face value because they have a white coat on or because they have doctor in front of their names, because we can't tell you the countless stories of people we've seen do things that don't even make sense, but they do it anyway, and that we so blindly trust people. We should never blindly trust somebody just because they have doctor in front of their name. You should ask questions. If you don't feel comfortable, if you don't understand something, then you should ask for clarification. It is not the nurse's job to explain what the doctor has said they're going to do or want to do to you. You need to call them back in the room if you don't understand something, because that's your job. And also, your body is your body, and nobody is allowed to touch your body without your permission. Like, I can't tell you how many times a doctor said, I'm going to check you, I'm going to do. No, you can ask, but you cannot force. That is harassment for someone, or for the hands or you, or tell they're going to do to your body without options. I mean, I recall being a teenager when I had a friend of mine who was having her fifth baby and she wanted to labor naturally, and the resident came in and told them that they wanted to check her. She told them from the beginning she didn't want her water broken. Oh, we're just going to check you. And she came with the and broke her water at the same time. And she was like, did you break my water? I told you I didn't want you to do that. She's like, oh, well, it's your fifth baby. It'll happen so quickly. That is wrong. Like, I mean, there's no reason for that at all. So know that you have rights, have the right to say no, you have the right to refuse care. If you feel like you're being ignored, tell them to put it in your chart that you're refusing to do X, Y, and Z, because a lot of times that'll make them behave a lot differently if you tell them to document it. But just know that you have options and you are the consumer, and that there are many of us that are here fighting for you every day and working to change things, because the way that things are going is not right. And the only way that will change is if we refuse the piss poor care that we continue to get and just be silent about it.
on that note, thank you, ladies, for your honesty, for your encouragement, your wisdom, for sharing your stories and your knowledge. We are a sister's keeper. So just this conversation alone, I'm hoping will help somebody else along their journey to motherhood, through motherhood, womanhood, everything in between. So thank you all. Thanks again, Josh, for allowing us to have the space to have this conversation. And I wish you all a very safe rest of the evening.
Thank you very much.
Thank you.
Thank
I
you.
enjoyed it.
Bye.
Bye.
Bye.